Hepatitis is a chronic disease that causes inflammation in the liver. Inflammation is swelling of the tissues in the body. The swelling occurs due to infections or injuries which can damage the liver and destroy liver functions. What is hepatitis? Hepatitis, an inflammatory condition of the liver caused due to viral infections, is hepatitis. It impedes the liver functions like toxins removal, hormones production, and vitamin storage, etc. The progression of hepatitis may result in fibrosis, liver cancer, or cirrhosis. It is of two types. Acute, short-term. It is a short-term and temporary condition that causes due to acute infections. Chronic hepatitis, long-term. The other viruses are chronic that cause both acute and chronic hepatitis. Let us take a glance at types of hepatitis. 5 types are affected by 5 types of viruses, and they are named after letters A, B, C, D, and E. Let us see a brief about each type. Hepatitis A virus, HAV. HAV is a small, symmetrical, and unenveloped RBA virus that belongs to the hepatovirus classification. It has the characteristics of the picornavirus family, and it is transmitted through the fecal-oral route. This virus is transmitted by drinking contaminated water or intake in contaminated food and found in the feces of the infected patients. Hepatitis B virus, HBV. Hepatitis B is the inflammation caused to the liver due to the hepatitis B virus. It spreads through the infected body liquids like exposure to infected blood, semen, saliva. It transmits from an infected person to an uninfected person. It can be acute hepatitis that lasts for a few weeks or 6 months or less than that, and a few times, it could be life-threatening. Hepatitis C. Hepatitis C is a virus that causes inflammation and damages the liver. It is a critical health complication and may cause acute and chronic hepatitis. The severity of the disease might take a few weeks, months to heal, or it might become a lifelong illness. It is a blood-borne disease. It occurs when an uninfected person comes in contact with contaminated blood, infected injections, improper hygiene, or unprotected sex. Fewer possibilities. Hepatitis C leads to liver damage or cancers. It is asymptomatic in the initial stages but takes around 12 weeks to exhibit the symptoms, but still, there is a complication of spreading the virus actively. Hepatitis D. Hepatitis D is also called hepatitis delta virus or delta hepatitis. It is the critical condition of liver inflammation caused due to a virus called hepatitis D and occurs only in people affected with hepatitis B. It is transmitted through the transfusions of HCV, contaminated blood, blood products, infected injections, sexual transmission. Fewer possibilities. HDV is critical. It might lead to liver cancers, a failure that leads to death. Hepatitis D does not have any vaccinations. However, it can be prevented by taking the vaccination for hepatitis B. Hepatitis E. Hepatitis E is transmitted only through the intake of contaminated water. It is found in the stool of the infected person. It is the virus that causes inflammation of that liver that causes swelling in the liver. This complication does not stay for a long time and does not damage the liver as the other hepatitis viruses do. It is crucial in people who have low immunity. It is said to be risky in pregnant ladies, elder people,